supraspinatus tendinitis. What are the special tests we will do in supraspinatus tendinitis? One is our drop arm test, another one is empty cat test. So the drop arm test, the patient will be in standing position, come to standing position, and ask the patient to do full abduction 180 degrees, not passive, active. So ask the patient to come down. So till 90 degrees, he will maintain it. From 90, the arm will drop. So which is indicating the weakness of the supraspinatus. Then the second test is empty cat test. As everyone knows, come to sitting position, patient in sitting position, therapist in front of the patient. The thumb will be, ask the patient to make a fist and thumb facing downwards. One hand at the supraspinatus, other hand at the lower end. And ask the patient to do abduction and apply resistance. When the patient complains of pain here, see, not flexion. If you are doing flexion, that is wrong. You have to ask the patient to do abduction and apply resistance. If you are applying resistance, the patient complains of pain in supraspinatus, test is positive. So these are the two tests which we will do in the supraspinatus tendinitis. Yes. Next. Yes, before. Yes. The other exercise which are useful to improve the strength of supraspinatus, that is your dumbbell lateral raises and the front raises. That is, lateral raises means come to standing position and asking the patient to do the lateral side with the help of dumbbell. Yes. We will give the dumbbell depending upon the capability of the patient. Then front raises, that is raising front. Okay. Front raises and the dumbbell raises. Next is the retraction one. So retraction lift exercise. Yes. And ask the patient to do the retraction exercises. Or asking the patient to be in sitting position and to do the retraction exercise of the both the hands. Next. Same as theraband. With the help of external rotation, we'll ask the patient to do the external rotation with the help of theraband. Then these are the PNF exercises what I told you. That is our D1, D2 patterns, mainly to improve the flexion range. Like for example, in D1, we'll ask the patient to do this one. Okay? And again, D1 extension, keeping the hand in extension. Then D2 flexion, like this. And D2 extension, back side. So all these exercise again, the PNF exercise will be useful to improve the range of the motion. Next. As usual, again the pendulum exercise will be useful to improve the range of motion. Then, and coming to the stretching exercise. Right on. Next. Yes.
Sì, ci sono يلا روح.
Make this straight. So to decrease the tightness, the first exercise is asking the patient to keep the arm and with other hand ask him to apply pressure downwards. So which muscle again? Stretching. Pectoralis, then triceps and your serratus. These are the, some of the common, sometimes your supraspinatus. So the next thing is come to sitting position and ask the patient to keep the hand on the table and ask this hand to move backwards. Usually the patient will be in slightly bending position and keeping this hand on the table, okay, and this hand will go backwards. So again, when we are going for backwards, the muscles which will stretch is your triceps, your biceps, then your pectoralis. Then third one again your towel stretch. So when he's doing the towel stretch, again all the muscles will be, which are in tight, it will go for stretching. Then horizontal adduction stretch. Can you do like this? Do the adduction. So which muscle? Stretch. Which muscle? Horizontal adduction. Your triceps, then any abductor muscles will stretch. Your supraspinatus will also go for stretch. So these are some of the stretching exercises which will be given to improve the flexibility. Clear? As usual, again after that you have to give some advice to the patient.